Have you ever been walking through the park or climbing a simple set of stairs, only to feel your legs ache or give out unexpectedly? It's easy to dismiss these feelings as minor inconveniences, but what if your legs are trying to tell you something important? This video will help you uncover the signs your legs might be giving about your health, signs you absolutely should not ignore. Let's dive in together, because knowledge and action today can lead to stronger, healthier tomorrows. Your legs play a vital role in keeping you active, independent, and engaged with life. But they're not just there for mobility. They're also direct indicators of your overall health. Poor circulation, pain, or other issues in your legs can point to underlying problems in your heart, veins, or even metabolic health. Think of your legs as messengers. When something isn't right in your body, they often send out early warning signals. Ignoring these could lead to more significant complications later on, such as limited mobility or serious illnesses like blood clots or even strokes. The good news: by learning to spot the signals your legs are sending, you can take steps to protect yourself. Let's start by looking at some common warning signs. Your legs might not speak, but they have ways of grabbing your attention. Let's talk about a few symptoms you should never overlook. Do you feel a strange pain or cramping in your legs whenever you walk or climb stairs that eases up when you rest? This is often called claudication and might point to a condition called peripheral artery disease, PAD. Don't just brush it off as old age or fatigue. It could be your legs asking for help. Noticeable swelling in your legs is another cry for attention. It might be caused by fluid buildup or poor circulation, known as venous insufficiency. If one leg swells more than the other, this could even indicate a more serious problem, like a blood clot. Take a moment to inspect your legs. Do you notice redness, blotchiness, pale areas, or even bluish tints? Changes in skin color can signify blood flow problems. For example, bluish skin could indicate that oxygenated blood isn't reaching your legs properly. Do your legs twitch at night or feel uncomfortable when you're at rest? This could be restless leg syndrome. While it often feels harmless, it might also be connected to issues like nerve damage or circulation problems. Do your veins look more noticeable than before, like they've swollen or started to bulge? This is often a sign of varicose veins, a condition where veins don't function as they should. While they aren't always dangerous, in some cases, they can lead to sores or clots. Have you noticed that small cuts or scrapes on your legs are taking forever to heal? This is a warning sign, particularly for those with diabetes, as it can suggest poor blood supply to the area. Understanding these signs is the first step toward better health, but what could be causing them? Let's find out. Your legs aren't the problem, they're the signal. Here are some common conditions they might be warning you about. PAD happens when narrowed arteries reduce blood flow to your limbs. It's a serious condition, often linked to heart disease. Symptoms can include pain when walking, shiny skin, or even hair loss on your legs. This occurs when the veins in your legs have trouble sending blood back to your heart. It can cause swelling, cramping, skin discoloration, and even ulcers if untreated. A sudden swelling or warmth in one leg could mean a blood clot is forming. These clots can travel to your lungs, creating a life-threatening condition called a pulmonary embolism. Sometimes, leg health issues are tied to pre-existing conditions like diabetes, high blood pressure, or obesity. These problems strain your body's circulation system and increase the risk of leg-related complications. Knowing what's behind these warning signs makes it easier to take action. But what can you do to prevent or manage these issues? Don't worry, we've got you covered. Here's the good news. There's a lot you can do to keep your legs healthy and strong. Small, consistent actions can make a huge difference in your comfort and mobility. Let's explore the key steps you can take today. Your legs love movement. Simple activities like walking, swimming, or yoga encourage proper blood flow, strengthen muscles, and reduce stiffness. If you can, try to avoid sitting or standing for extended periods. Even getting up to stretch every 30 minutes helps. At the end of a long day, elevate your legs to encourage blood flow back to your heart. You don't need a fancy setup. Just rest your legs on a pillow while lying down. Shoes matter. Choose well-fitted, supportive footwear that doesn't pinch or strain your feet. For those with varicose veins or circulation issues, compression socks can also be helpful. A nutritious, balanced diet does wonders for your veins. Focus on foods that support circulation and heart health, like fresh vegetables, fruits, whole grains, and foods rich in omega-3s. Also, stay hydrated. Dehydration makes blood flow more sluggish. If you have diabetes, high blood pressure, or any other chronic condition, make sure to follow your treatment plan. Regular doctor visits, taking prescribed medication, and monitoring your health are essential to preventing complications. Not only do these habits keep leg-related discomfort at bay, but they also improve your overall health. However, there are times when healthy habits aren't enough. So when should you consult a doctor? While many leg issues can be managed at home, some require professional attention. If you notice any of the following, don't wait. Schedule a doctor's appointment. Persistent pain or cramping that doesn't improve with rest. Sudden, severe swelling in one or both legs. Warmth, redness, or tenderness, which could suggest a clot. Open sores or ulcers that aren't healing. Your doctor can provide accurate diagnoses and tailored treatments, making it easier to resolve these leg health challenges before they escalate. The earlier, the better. Now that you know the risks and warning signs, let's focus on simple ways to ensure your legs stay strong and healthy. Here are a few exercises and lifestyle tips you can incorporate into your daily routine. Start with these gentle movements to strengthen your legs and improve circulation. Ankle rotations. While seated, lift one foot off the ground and rotate it in a circle. Switch to the other foot after 10 seconds. Calf raises. Stand up. Lift your heels off the ground, hold for a few seconds, and lower back down. Repeat for 10 reps. Toe taps. While seated, tap your toes against the floor in quick succession to warm up your leg muscles. Walk for at least 20-30 minutes a day. Avoid crossing your legs when seated, as it can restrict blood flow. Drink plenty of water and limit salty foods to reduce swelling. By taking these simple steps, you validate what your legs have been trying to communicate, that they're essential and they need your care. Let's take a moment to recap. Your legs are incredible, but they're also complex and interconnected with your overall health. By listening and responding to warning signs like pain, cramping, swelling, or discoloration, you can take control of your leg health. From adopting daily habits like walking and staying active, to managing underlying conditions like diabetes or vein issues, there's so much you can do to ensure your legs stay strong and keep you moving. Most importantly, don't ignore what your body is trying to tell you. It's always better to act sooner rather than later. Your legs are calling for help, but with a little extra attention and care, you can help them work their best for years to come. Finally, if this video has been helpful, show your support by liking, sharing, and subscribing. Together, we can keep learning, thriving, and living actively. Until next time, stay healthy, keep moving, and remember, happy legs lead to a happy life.